When I think of what trust means for a health plan during a pandemic, I go back to the basics of intent and empathy, transparency, of inclusiveness, and being reliable in your actions. It was really important for Anthem as an insurer to express empathy, not just through words, but through actions. Um, we sent our clinical teams out in the field to help with care management in the worst of times. We walked our employers and our brokers through COVID heat maps to help them understand the reality of their specific communities and help be a thinking partner with them as they tried to plan their reopenings. We offer them premium rebates to delay premium payments as they endured their own financial pressures. In terms of our provider relationships, we had to really hustle to help them find PPE when that was a real pressure point. And we gave independent primary care groups direct financial assistance, understanding that they were among the most vulnerable fiscally. We shared COVID risk rosters with our value-based care providers, helping them to identify those patients who were at highest risk for morbidity and mortality should they become infected, as a way to allow them to reach out to those patients and really engage them in prevention and testing. And we overlaid all of that with as much data as we could find on social drivers in order to more deeply understand how those vulnerabilities overlay COVID risk. Anthem actually ended up calling over 1 million members directly. Now, that was driven in part by the fact that we saw such huge escalations in Medicaid and healthcare exchange enrollment because of the recession and unemployment. But we reached out to those members because we understood exactly how high risk they were. We did it to help them understand not just their insurance, but also get them enrolled in SNAP and WIC benefits wherever that was applicable, because food insecurity was clearly a major concern for them and a looming threat to their health. And like many insurers, we've had to make hundreds of policy adaptations along the way to remove administrative barriers like prior auth and other requirements so that clinicians could just focus on what they needed to do, while we still tried to keep them as engaged as possible in value-based care. All of that comprised the acute response, but I think we all understand that in the long term, insurers really need to commit to much deeper structural changes to build and sustain trust, even if that involves using the COVID experience as a jumping off point. To my mind, that means really long-term investments of both financial capital and political capital, which I think insurers tend to underuse for these purposes. So, one example is that Anthem is partnering with community-based organizations and local government in Indianapolis, which is our headquarters, to work on long-term solutions for food insecurity for specific neighborhoods. And that may mean increasing economic opportunities along with bringing in grocery stores and other sources of high nutrition food sources. I would love to see health plans make it more of a habit to use their high margin businesses, like in their commercial lines of business or Medicare Advantage, to cross-subsidize other businesses where the margins may be slimmer, but the needs just as great or larger as in Medicaid or the exchange populations. That's not a habit, a business habit that's easy or natural, but I think that we are at a point in time where the disparities are so gross and massive that we need to maybe think about doing things not how we usually do them. I would also love to see deeper community involvement for insurers to either collaborate in a given place or find some other way to get over their usual reticence around the collective action problem or free rider concerns, and get over those barriers to make real community-wide investments that last. And I'd like to see insurers become true partners with public health agencies to build out a holistic strategy on a community level rather than waiting to deal with the downstream consequences in healthcare. Given the overlay of social justice issues that are happening right now on top of COVID, it's harder and harder for insurers to ignore the need to break something, or maybe many things, many old ways of doing things in order to fix a system that reliably disadvantages the populations who have the greatest health vulnerabilities.